Hello, I'm Jessica Samuels. Welcome to A Way Forward, presented by Beem Credit Union. I'd like to acknowledge this podcast takes place on the ancestral, traditional, and unceded lands of the Okanagan Syilx people. Once again, today I'm joined by CMHA Kelowna Director of People and Culture, Candace Giesbrecht. Now, she's here for part 2 of our discussion about mental health in the workplace. If you want to listen to part 1, it's episode 11. Today, Candace and I are going to dig into burnout and its connection to work. Candace, in the previous episode, we talked about how to measure and have some positive influence on mental health in the workplace, mentally healthy workplaces. It's a bit of a tongue twister because there's lots involved in it. We talked about that, and it was really interesting because you shared an experience about a couple of years ago when you came to CMHA Kelowna. The Guarding Mind survey indicated that staff were close to burnout. You shared that you picked that as the focus, and it took a couple of years to really address it, with the understanding that there might still be a little bit of work still to do, but you're feeling better about it. And more importantly, staff are feeling better about it.
Yeah, I mean, we're seeing some indications of the work that we've been doing, and indications like the measurements that we have access to through our benefits. So people accessing the supports that they've been provided. We noticed that our number of open vacancies is way down, like less than half.
Right.
And so the amount of work and the puzzle pieces that have come together in order to accomplish this tells us that not as many people are leaving, and it's easier for us to fill. And so, we look at some of these indicators. I mean, what I feel confident in saying that our staff are good now and that burnout is no longer a concern. No way. It is an ongoing concern. And especially with, the world hasn't gotten any easier or less stressful, and the pressure's on folks. So it's an ongoing concern, but as an organization, we identified a number of things that we really felt were impacting the burnout of our staff, and we're seeing the payoff of the investments in those areas.
It's so interesting when you talk about burnout and you mention some of those indicators that may not be top of mind for employers would be a reflection of burnout. So I think a great place to start is the definition. Burnout is a word that perhaps it has been used quite broadly for a number of things of late. It actually has a very psychological, very specific definition that is associated with workplaces and the psychology of workplaces.
Yeah, workplaces and the psychology of workplaces, but I would expand that a little more to work. Yeah. And so the nuances here, I think, it's not just about the workplace or just referring to paid jobs or paid work. So often there's burnout that comes with the work that's associated with caregiving, or there's the work that's associated even with volunteering or with parenting. And so it's more about work than the workplace is a nuance that I would want to add.
I appreciate that because, and perhaps it was my not fully understanding or misinterpretation of it, as I prepared for this, I thought, well, how can, life is hard, which is what you just said. Can't I be burnt out from, or feel burnt out from other things?
Yeah.
So what is the definition? Is it the feeling of overwhelm? Is it the feeling of don't know what to do next?
Yeah. So when we look at, and there are a bunch of definitions that are readily available online, but I thought it might be kind of fun if I could take when we're talking about burnout, to take a look at a definition that was provided by the World Health Organization, where they look at they really break it down into 3 different dimensions. But I like alliteration, and so I came up with 3 Ds that I think capture the things from the World Health Organization. So the first one is depleted. And so there's physical, emotional, psychological, maybe even spiritual depletion. When I burned out many, many years ago, I was aware that I was stressed and that I was tired and that I was, not necessarily overwhelmed, but just I had nothing in the tank. I first really found out when I physically collapsed. And so the first D here is depletion. And so it's that sense of like, just, I'm trying harder isn't working. I got nothing to pull on, nothing mentally or physically or emotionally or spiritually that I can pull on. So the first D is depletion. The second D that I have here is distant or disconnected. And so it's that feeling of kind of, floating in space a little bit, like I'm going through the motions, I'm doing things, but I don't feel connected to them. Or, on the flip, we would look for engagement, or we would look for, feeling engaged and connected to things. So that's the second D. And then the third one, I had to struggle a little bit with, but I put here downer. So the sign of someone who's burned out, or maybe if we're looking in the mirror and we're trying to figure out, am I burned out? It's that cynical downer kind of like, you tell me one thing and I go, yeah, but blah, blah, blah. So it's that downer kind of piece. So depleted, disconnected, or distant. And that downer kind of behavior, thoughts, words.
Okay. All right. I love that.
Is that helpful?
No, it is. And I like the alliteration as well. It helps with remembering it. You mentioned that burnout can be associated with work in whatever that work looks like. In the context of this episode, and we're talking about workplace mental health, mentally healthy workplaces, could then I surmise that if I am at a mentally healthy workplace, there would be no burnout?
No.
Oh,
wouldn't that be
not
nice?
That simple.
Wouldn't that be nice?
Surprise.
Yeah.
Okay.
Yeah. No, I mean, when we look at any kind of unwellness, I mean, as a workplace, we want to try to identify what are the things that we can prevent. So what are the things that we can do that might head this off in the first place? Or identify it early so that we can catch it before we're at that point of a person losing their health, losing their, employment if things go really bad and so on. But so we want to try and prevent, we want to catch it early. We want to have the mechanisms in place and the education and the training so that we can spot it. We can call it out. We can, hopefully have a safe and respectful conversation where we go, you are not yourself. Like, are you okay? What do you need? How's it going? What's happening? Like, and the 13 different factors that we talked about in the last episode that are the 13 psychosocial factors, then those become some of our levers or some of the ways that we can look at. If we need a to-do list, if we're worried about someone who we're concerned that they're burning out, we can look at those pieces and say, are you feeling supported? Have you been provided with clear leadership and expectations? Are you physically safe? Are you, what's happening with workload? What's happening with, and we can kind of use it as a way of looking at different levers. And then when we know that there's a problem, that as a workplace, we have ways of intervening and responding that are respectful, that are safe, that are health promoting, that are good. It's like this Venn diagram of, what's good for the person and also what's good for the organization, whether it's, for profit or not for profit. We've got these goals and we're looking for that crossover around, we care for you and we care about this place. And right now what's happening for you is having an impact. And so for you and this place. So we need to have ways to try and intervene and respond.
And how do you know what those ways are? I mean, are you talking about foundational ways that are at the root of it? I would imagine that there's going to be ways that are going to be specific to each workplace. As an example, you talked about the steps that CMHA Kelowna took to help address and prevent or mitigate burnout for its staff.
Yeah, I mean, there are different sectors, there are different organizations, there are different kinds of mechanisms that are appropriate. I mean, often what we hear from organizations or businesses as we're out doing training is they, there's a nervousness about having these conversations that, what's okay to talk about or what is, where are those lines? Also, I'm their boss. It's not appropriate for me to be their counselor. I don't, to some extent, I don't want to get involved in their stuff. And so figuring out and navigating some of those lines is hard. But we do have a responsibility as employers to inquire and to ask people how they're doing, and then to work with them in being part of the solution. And that isn't just, stepping into people's personal worlds. This is what makes business sense, is to have the conversations. Brene Brown, who I think many of us are fans of, she says clear is kind. And so the clearer we can be about what's working and what isn't, and what we're seeing or what we're worried about, or, I'm seeing this and the thing I'm wondering is, then the safer and more open that we can have those kinds of conversations, and also even set some limits sometimes, the better off we can all be.
Right. In preparation for this, you sent me over some information from the Community Social Services Health Association of BC. Some interesting stats in there, and what it led me to wonder, two things. So are there going to be some sectors that are more prone to burnout? And specifically from what I saw from that kind of led me to this question, some types of work or businesses. And then I wonder if we can chat about, based on the uncertainty and turmoil of the last 5-6 years in general, are there any observations of whether incidences or rates of burnout are on the rise? So two questions there.
Yeah. So the first question is a little bit of a tricky one, because on the face of it, the sectors that are working directly with humans who are vulnerable or maybe, sick or unwell, some of the sectors like healthcare or social services, those are sort of the obvious ones, and definitely where this study came out of. And, one of the stats, I mean, I knew it was tough out there, but this was like kind of shocking. It said in BC, there was an increase of 52% of the number of days lost to work, an increase over the last 4 years. And so, those are kind of the obvious ones, but, I'd be hard pressed to say what sector hasn't been negatively impacted over the last number of years, because we're all living in this world where things are hard and groceries are expensive and kids are, having different kinds of struggles than we've seen. And so, I mean, I think we could look at some of the numbers, but my inclination is to say we're all in this. We're all trying to figure out a world that's unlike anything that we've ever seen before, and it's new territory in almost every way. It'll be interesting as we look ahead, just with changes to immigration policies or things like that, where some sectors are very, very dependent on newcomers to the country. Like, we've seen what happens with labor shortages in healthcare or, maybe in some other areas, but this is going to have a big impact on us. And so what's the fallout of that as we consider impacts to business supply chains, factories, like, farms, schools, healthcare. Like, I mean, I can't think of a sector that I wouldn't expect we would see some very concerning trends within, because where there are humans, then these are human problems more than sector problems, I think.
Right. And so some of those solutions would be human specific, but also sector specific as well, which you mentioned before. I want to go back, and hopefully you don't mind me asking, how were you able to overcome, I guess I should say, have you overcome your burnout?
Yeah.
Okay, good.
Thank you.
Yeah, sorry. Yeah. but because of that complicated nature of it, how, I guess you said you recognized it because you literally passed out, fell on the floor,
collapsed.
How were you able to carry forward?
Yeah, it was. So it was a very long time ago. It was it was sometime after I just returned to work after the birth of my son. And I really, what I started learning about was the impact of a little bit of postpartum depression combined with, there was a new boss at work, and it was an intense time, it was sort of a perfect storm of things. But the biggest thing that I learned, and that I continue to learn, is how my mental health works. And kind of, having a little bit more compassion for myself or in various areas. So what I mean by that, because I feel like that could sound a little fluffy, or that could sound like it's definitely vague. But what I mean by that is that I learned that, for better or worse, I'm not good at working just between 9 and 5 on Monday to Friday. That's not how my brain works. So the hard part of that was that I showed up for all of the 9 to 5s, like for the 40 hours or whatever. Plus, I just kept working at the times where my brain actually was engaged. And so, the hard part was that I didn't know how to shut off, or I felt like I needed to show up and be present and productive at times when I wasn't productive. And then in other ways, but I still needed to get the work done. And so then when it was working for me, then I was doing it after hours. So one of the things I just stopped fighting was the fact that sometimes my brain works better at 6 a.m. or at 9 p.m. And I don't know what it is about that, but I just stopped fighting it. And I started embracing it and working with my employers to figure out the ways so that I can have a little bit more flexibility. Other people are very good at being present and productive on command. I am not one of them.
That flexibility piece you mentioned last time with the 13 factors, because of course you were telling that story and you have this range of and variety of when you're your best to work. The other as an employee, the other part of that is having an employer who is willing to hear that and work with it. And that's where that piece of that mentally healthy workplace comes in, right? That's one of those factors.
It absolutely is. And so that, but at the core of that is the relationship and the trust and rapport that has to exist between, the employer's got to be willing to have that conversation, and the employee to some extent needs to have some skill and some confidence in being able to say, can we work out a different way of me getting the work done? Like I had a fantastic mentor, Dr. Laura Hambley. Totally recommend you check out her stuff. But she just said we need not confuse presence with productivity. So when we can, as an employer, look at, ultimately what we want is. We all want the productivity. The productivity is going to help the bottom line. It's going to help the business. It's going to help us make a greater impact, whatever the thing is that we're measuring or that we're trying to accomplish. But saying, and it must happen between these hours, for many jobs, for many roles, it is important. Like if you work at a bank and your job is to be the person who meets customers, then that's another matter. But for many things, let's get the work done and let's figure out what's gonna find that sweet spot between productivity that suits a person and what the organization needs.
Right. So going back to that Guarding Mind survey and that using it being a tool for employers, one of the questions that I didn't ask you last time is how you talked about how you kind of get the green light, yellow light, and the red light. What's interesting is to me is how do the questions work? Do employers, are they able to have some flexibility on the questions, or is it a standard set of questions?
No,
again, because it would be sector specific.
Yes, exactly. Okay. Yeah. So with this particular tool, the questions are not editable. So, they're set, and there's a very good reason for that. These questions have been tested.
Okay.
They are evidence-based. They have been pushed and pulled across a number of different, sectors, level, different kinds of expertise has weighed into this. And so the words are very carefully chosen, and the questions are testing quite specific domains related to these 13 factors. It is possible to get, tailored engagement surveys that would accomplish a very similar thing to the Guarding Minds at Work. What we love about Guarding Minds is that we know it's evidence-based and that we know it's free. It's accessible to absolutely everyone. But, there are a lot of professionals, but what will often happen with consultants related to these kinds of surveys is that while there may be a little bit more choice, there's still, at least if they're done by professionals, which, that's what we're talking about here, they will still be choosing from a bank of questions that are evidence-based and that are, So, and if somebody is, maybe testing out a consultant, that's actually a good thing to test. Like, if they say, we can work on the questions and completely edit them together, that actually might be a little bit of a flag for me.
Okay. Yeah. You brought up an interesting thing there. So there's the Guarding Minds. You mentioned a consultant. What are some other things a workplace can do to kind of take those steps to manage, you know, and establish that respectful, you know, psychological safety in a workplace. I imagine CMHA Kelowna, through that 2 years of working through that, you didn't only do the Guarding Minds survey. There other things happened.
Yeah, there were other things. Yeah. So, I mean, you know, the suggestion for, you know, organizations who are wanting to do this is like, ultimately, we want to find ways, and ideally multiple ways, for people to tell us how they're doing and how it's going. And so, there may be a combination of, you might do focus group kinds of sessions, you know, opportunities where within a group setting, and you could have a neutral person, or it could be run by you know, senior staff, or the HR department if you have one. So the, you know, it could be in a group setting, it could be survey, and then there's, you know, questions around like anonymous or not. But the hope is that we're finding ways to get that two-way feedback, and that we're creating those conditions and those opportunities where we can know, not just at a point in time, which can be very valuable and important, but, you know, that we have opportunities and ways when people can tell us when they have an idea or what's going well, and also what they would like to see happen differently. And just when you think you've nailed it, then, you know, like then you probably have some more work to do. And you know, this is one of those things that's also time intensive, takes a lot of time and investment and circling back. And I mean, we were just talking about it today, that you know, it's been a while since we circled back to staff and told everybody about the kinds of things that we've been working on from when we asked them how they're doing. So it takes time and intention. But, you know, going back again to something I said last time, my argument is you'll pay either way. So you either pay in investing in some of the proactive conversations, or you're going to pay on the other end when you start seeing high turnover, or you start seeing some toxic behaviors, or you start seeing some unhealthy, you know, conflict or things like that are happening. Lost productivity, lost days of work, and so on.
Employers are going to pay either way.
You pay either way.
Okay. Thank you so much, Candace.
Yeah, you're welcome.
Well, hopefully somewhere in there you have some ideas about how to prevent burnout, whether it's in the workplace or at work. And if you're an individual who's an employer in a workplace and you want to find ways to foster a mentally healthy workplace, of course, we're going to have those resource links for you on the Way Forward podcast page presented by Beem Credit Union. As always, if you have questions about this episode or any episode, you can email us at awayforwardkelowna@cmhakelowna.org. You can always email us at awayforward@cmhakelowna.org. In the meantime, please take good care. Beem Credit Union supports mental health initiatives across British Columbia because caring for each other builds stronger, more connected communities. United as one, Beem's founding credit unions now serve 190,000 members across BC.